Hi there, and good morning from New York. This is Mental Health and Business. Um, I had the pleasure this morning of interviewing a colleague and friend of mine named Dr. Don Greif, who's a clinical psychologist, a psychoanalyst, and a forensics expert. And I'm very, very curious to hear him talk to us about his new paper, which is called Slow Therapy, Psychoanalysis as Counterculture. Uh, Not a beach read. Anyway, hi,
Well,
Don.
if you want to fall asleep on the beach, it might work well.
Oh, you're way too modest. So we've you and I have talked a bunch about this, but I'm really interested in taking a deep dive into it. So maybe you could explain how you got the title first. I mean, take it from there.
So there was a literary critic, writer named Lionel Trilling,
Oh yeah, sure.
was very well known back in the 40s, 50s, 60s, taught at Columbia, wrote a bunch of books. And one of the books he wrote was called Freud and the Crisis of Culture. And he talks in that book about how Freud had a quarrel with culture.
Hmm.
Ultimately, Freud believed that one needs to sacrifice some degree of happiness to live in culture.
Mhm.
Freud, by the way, used culture and civilization synonymously. Um, the title of his famous book, of course, is Civilization and Its Discontents.
Right.
So, quarreling with culture is what I derived from Trilling's uh, take on Freud,
Hmm.
and discontents. I took that from Freud's book, so I combined them: quarreling with culture and the value. Oh, I'm sorry, I'm talking. This is really funny. I'm talking about something completely different,
Oh
and the reason I'm talking about this
yeah.
is because I've been working on this. Um, I'm writing a book proposal, so it's so much on my mind. So that's really funny. Okay, let me back up here.
Let's start
Uh,
again.
yeah, yeah. Slow therapy. Um, so I saw Jonathan Franzen interviewed many years ago,
No.
and Jonathan Franzen is a novelist. Um, he's written, several well-known books.
I
One
love this stuff. Yeah. Yeah.
Freedom,
The
one called
corrections.
The Corrections, and a couple of other books. And one of the things he said was he talked about the value of reading a long book like War and Peace. Described it as an opportunity to live with something for a long period of time, to get very immersed. And he talked about it as kind of a um, antidote to so much of contemporary culture.
Hmm. Hmm.
Uh, with texts and emails and social media and so on, everything is quick and short term. So when I heard this, I thought this is kind of like psychoanalytic therapy.
Hmm.
The opportunity uh, to slow down where there's not a priority on getting results quickly as possible.
Right.
And so, and of course, the slow food movement had been around for a while.
Hmm.
Um, so that's where I got slow therapy from. And the counterculture part was was based on this idea that psychoanalytic therapy these days can be considered countercultural in that it's so antithetical to so much of contemporary culture.
Hmm.
There are other mental health treatments that prioritize speed, results as quickly as possible. You've got psychopharmacology or drug therapy. You've got short-term treatments like cognitive behavior therapy. So psychoanalytic therapy has a different philosophy, a different method. Um, Now, I think it's important to emphasize that psychoanalytic therapists care about results and get results, sometimes quickly,
Yep.
but uh, in order um, for symptoms and problems to not come back, not return, uh, the strategy is to get to the underlying problem or problems, um, which usually takes time. And when I talk about underlying problems, of course, I'm talking about those things that are out of awareness, or that might be in subliminal awareness,
Right.
the
Right.
subconscious, that are motivating
Yeah.
our behavior, and especially our maladaptive patterns.
Yeah. Let me just type in when I hear counterculture, uh, I think of the hippies, right? Because that was like really, Vietnam and free love and sex and drugs and all that. What is? I mean, just just so everyone listening understands what we're talking about. I agree. I agree with you, of course. But what's an example um, of how psychoanalysis or psychoanalytic psychotherapy? What's an example of how that's countercultural?
I think there are several ways. One, and the most kind of basic way, psychoanalytic therapists prioritize patients' experience. And that means what they feel, what they think, what they imagine, what they dream. Um, and that in itself, that interest in inner experience, the inner life, I think that that's pretty countercultural. It's not the way certainly not the way most mental health treatments work.
For sure.
Um, and it's also, in terms of the broader culture, it's uh, it's not that common.
So
Um,
right. So that's helpful. So you're saying that psychoanalysis and psychoanalytic psychotherapy is necessarily privileging this subjective nature of who we are. That psychoanalysis is not interested in putting people in categories. In fact, the the mission, such as it is to help people get in touch with who they are, which may not have anything to do with the culture, right?
yes, exactly. So somebody is depressed. They'll see a psychiatrist or a psychopharmacologist, a psychiatrist that specializes in treating psychological problems with medicine. And the psychiatrist will be interested in their symptoms of depression, whether it's insomnia or low mood, um, you know, inability to get out of bed in the
Right.
morning, and they will prescribe a drug in order to try to remedy the symptoms.
Right.
Psychoanalytic therapist will hear that somebody's depressed and they'll want to know a whole lot of stuff about the depression, what the person experiences, what their what they feel, what they think, what they, when things started,
Mhm.
when they began to get depressed, what was going on in their life at that time. Um, have they been depressed before? Is there a family history of depression? I mean, these are all
Right.
things, but uh, they also want to know um, kind of what role it plays in the person's life, what meaning it has.
Mhm.
Sometimes depression, I should say not sometimes, but oftentimes it's motivated. It can be an identification with a depressed parent.
Mhm. Mhm.
It can be a flight from reality,
Yeah.
from dealing with the challenges of living, an escape of sorts, or a refuge. So that's that's the kind of thing I'm talking about. But this is just one level at which it's. I think of it as countercultural. And yeah, to go back to your association to the hippies, um, I'm thinking of countercultural. They were certainly countercultural, but I'm thinking of it in a uh, maybe a broader, more generic way of something that is contrary to cultural conventions, to the norms.
Mhm.
It's counter to it.
Right.
And so psychoanalytic therapy, certainly in its pacing, in its rhythm, if you will,
Mhm.
uh, you know, is radically different from emailing, texts, social media. Um, we generally speaking want to let people who we're working with, we want to let them go where they want to go. So when we we're interested in what's on their mind
Right.
at the time.
Right.
Freud, as of course and emphasized free association, which was basically um, an interest in seeing what was on his patients' minds, what they were thinking and feeling, and reporting it without in as unedited a way as possible.
Right. Right. So tell us what's free about free association.
Well,
I had a patient.
you have to pay a lot of money to be
I had
able to do it,
a,
unfortunately.
I had a patient many years ago who's I was teaching him how to free associate, and he said, "At these prices,
Nothing's
at these
free.
prices, nothing's free."
um, yeah, that's funny. It's well, I mean, on the other hand, it's not something where um, most of us are encouraged to do or have even have any experience with.
Right.
Uh, I suppose people who are more creative, people in the arts, probably are more used to a certain kind of, letting their mind go where it goes and seeing where it goes.
Right. Without constraint. I think that's what you're getting at, right?
Yeah, I would say there's always some constraint, but you want to try to encourage as little as possible. And when I say that, I mean especially, I mean, I think it's something that develops over time, a greater freedom
Yeah.
to say what's on one's mind, you know, because people want to keep uncomfortable or painful stuff out of their minds, especially early on before they uh, feel safe and trusting
That's
in
right.
a therapeutic relationship. Um, feelings of shame and guilt, anger, hatred, those are, for many people, it's going to be a while before people are comfortable bringing those into into therapy because they're worried what the therapist is going to think. They may be worried what they're going to think
Yep,
themselves.
for sure. What kind of patients are you looking for? Like, when you think of new patients, what's a profile of a good patient in your estimation?
I like working with people who are curious about themselves, about their lives, who want to know more about themselves and their lives, people who are able to reflect on their experience, people who've thought about themselves.
Mm-hmm.
And they may not have come to understand much about themselves. That's okay.
Right.
But it's the wish to know, the curiosity, um, and yeah, the capacity to reflect, to observe, to think about oneself,
Mm-hmm.
and to think particularly about one's internal life. Um, I think those are two things um, that are important to me.
Mm-hmm.
If not everybody has these capacities or has them well developed early on, and that's fine. But uh, is lots of people develop these capacities when they're in psychotherapy.
Right.
These are things that many people in our culture are not encouraged to do.
Right. Well, being thoughtful is countercultural right now.
Yes.
Yeah.
Yeah, that's a
Um,
whole other thing. What's considered countercultural these days?
yeah.
Yeah,
Yeah. 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 Fascinating. Fascinating. And then you also have we can go back and forth here, but you also have this very healthy forensic practice. Could you tell us a little bit about that?
sure. So the word forensic means of or pertaining to the law. So I get involved in legal cases. Typically, I'm hired by lawyers, and my practice um, focuses on several different types of cases. I've done a lot of work with evaluating people who've committed sexual offenses or who've been sexually abusive. I've done a lot of work with victims of
Mm.
sexual offenses or sexual abuse, sexual molestation. Um, Done a number of evaluations of adults who were abused when they were children, who were in um, schools in the Catholic Church.
Mm-hmm.
Um, then I've done the other area that I have focused on is employment discrimination cases.
Hmm.
So I get hired by employment lawyers um, who uh, who are representing typically plaintiffs who are suing um, an employer or former employer or an individual boss who has discriminated against them
Mm-hmm. Mm-hmm.
or who has um, mistreated them in some other way. It could be molested them, um, could be abused them in some way. Uh, so those are the two areas that a lot of my forensic work has been involved with, and I mean the work itself involves doing an evaluation, and then uh, if the case comes to trial, I'll be deposed by the other side
Right.
and testify in court as an expert witness.
Sounds great. So you're a busy guy with your clinical work on the one hand and the forensic work on the other hand.
Yeah, it keeps me, for the
Keep
most part, it keeps me out of trouble.
keeps you
I,
out of
you know,
trouble.
uh, and I also have a small sports psychology practice, and that involves treating athletes, uh, mostly amateur. I've treated some professional athletes who are struggling in one way or another related to their sport.
Struggling with the yips.
It could be a performance issue. It often is a performance issue that brings them in. Could be the yips, and um, it's interesting because oftentimes the causes for the for problems in sports are the same kinds of issues that everybody deals with. Could
Right.
be, depression, anxiety, relationship problem. But I like doing this work because um, I love sports. I was very involved with sports growing up, and I'm still I'm an avid golfer. I've played a lot of tennis as an adult, and I also love ping pong. So,
Yeah, yeah, ping
and
pong.
I'm interested in seeing this new ping pong movie with Timothy Chalamet.
Yes. Yeah.
So,
Yeah. Well, ping pong, is ping pong a metaphor for therapy? Maybe,
wow,
maybe.
that's one I've never thought of.
You know?
You know that I think when therapy is going well, it could be.
Yeah.
Yeah. I mean, well, it would be a good game of ping pong if that's it. Yeah. I mean, you know, we, well, it's interesting because I think the kind of therapy that you and I do, we're more actively participating than than classical orthodox Freudian psychoanalysts, where they hardly said a word.
That's true.
And, um, you know, they, uh, we, I'll speak for myself. I get involved and I talk. I'm responsive, and, you know, um, so there is a back and forth, a, kind of a, in the same way a game of ping pong, has.
Yeah.
So,
I think that's one of the, I think you're right. Of course, that's one of the ways that distinguishes, um, you and me and how we were trained from other schools of thought is that we don't sit there like lumps and say nothing. Here's a question that I always hate. But
and why are you asking it?
well, because I think it's, I think we need to. I think our audience would be interested. If someone asks you how you work, right? Like, what do you say? What do you say?
Uh, yeah, that's
What's your
always a hard one. I hate that question too.
what's your orientation? Like, that's the worst question ever.
I say that I'm usually disoriented. Uh,
The perfect answer.
um, I, I'll say things, uh, I mean, other than suggesting that they read some of what I've said on my website, where I do communicate my kind of philosophy and approach.
Mhm.
Um, I'll say, I might do what I was just talking about before, differentiate, um, what we would call relational or interpersonal approach from a Freudian orthodox approach. Um, I'll say that I try to understand my patient's experience,
Nice.
um, and and try to help people uh, learn about the underlying stuff that that's that's leading to their struggles in life
Yeah,
and pain.
that sounds pretty good to me.
I try to keep it simple. When I veer off, I get too like intellectual, and
Right.
that's when I feel when I cringe.
Well, I think one of the right what you're saying is of course true. I think one of the things that stands out for me with psychoanalysis, at least the way we've been taught it, is that we don't have a model of how people should be. We try to help them discover who they are. So we're not. There's no there's no sort of pseudo scientific metric about you should think this way, feel that way. And for some
Yeah,
people, that's incredibly liberating, and other people can't do it, don't want to do it.
right, right. Yeah, I mean, I think you're talking about people discovering who they are, or developing the freedom to be who they are.
Yeah, right.
Um, and, that's not for us to decide, obviously. Um, I mean, I think it's interesting because, parents often have a tough time with this, letting their children discover who they are. And, they have often a strong investment in their child being who they want them to be.
That's right. Little
Uh,
mini me's.
what's that? Mini
Little,
me?
yeah,
Yeah,
mini me's. Yeah,
right, exactly. Yeah.
cool.
So,
That's cool, Don. All right. Well, how do we get a hold of you if people want to find you? What's the best way of getting a hold of you?
well, I have a website, Dr. Don Greif. If you Google that, you'll find it. And it's got my contact information, but I can also give it to you now if you'd like.
Sure. Let's hear it.
So my phone number is 917-597-2531. And my email address is greif.don@gmail.com. And that's GREIF. That's important. E before I. f.don@gmail.com.
Nice. Super. Well, listen, that was really fun. That was really fun. I'm sure our audience is going to appreciate this interview, and maybe we can circle back in some time and do it again.
Sounds good.
All
Yeah.
right, man. All right. This is Mental Health and Business signing off. We'll see you soon. Bye.